complement system, inflammation, antiviral response. Okay, that's the process of the innate immune system. So let's go through the cells. What is the function of the macrophages? That's my first question. Phagocytosis, for sure. Okay. Antigen present, professional antigen presenting cell. Okay. So I advise you to share the immune system into three parts: innate immunity, B cells, T cells. Okay, I will use this schema. Share the pathogens into extracellular and intracellular. Okay, so only two kinds of pathogens. And the immune system has three main functions: must recognize the pathogen, must kill, eliminate the pathogen. And the third one is the communication in the immune system. Okay? So macrophage and three functions: can recognize the pathogen. Very good in recognition. Macrophage is one of the best in recognition. Can kill the pathogen. By phagocytosis, you told me can kill the pathogen. Can communicate with the innate immune system. With the innate. How can it communicate with the innate? Can, yes. It can. How?
Chemical messages.
Not everyone. By cytokines, that's a good response. So you told me that it's a professional antigen presenting cells, so can activate the T cells, can communicate with the adaptive one, but why by cytokine can communicate with the innate immune cells. Okay? So macrophage can do everything. The only cell in the immune system is good in recognition, communication, elimination, the Chuck Norris of the immune system. Okay, the only one, the only complete one. Let's go back to the communication with the innate immune system. Now, where can we find macrophages in the human body? In all the tissues. Okay? So macrophage will be the first one who recognize the pathogen. Anywhere the pathogen enters to the human body, macrophages recognize it immediately, as quick as possible, and kill it as quick as possible. In this moment, all of us is infected by pathogen. All of us, macrophage recognize and kill it, and finish. That was the immune response. Okay, that's the quickest, the simplest immune response. Macrophage alone can do it. Ask Chuck Norris, can kill all the pathogens. What will happen if too many pathogens arrive? Macrophage alone cannot kill it. Can I open? Can you open? I don't know, because you will die here. And I will be responsible for it. I don't mind that you die. I'm responsible. If you can, it's too cold, and close it. Okay, so what shall do the macrophage if there is too many pathogens? Cannot give. Ask help. Who can help the macrophage? Mostly the neutrophil granulocytes. Okay, that's good. So a macrophage will ask the help of the innate. What's the characteristic of the innate immune system? Quick, but non-specific, no memory. Okay? So if we want to kill the pathogen immediately, we must ask the help of the innate immune system. Okay? So macrophage will ask. How can ask the help? It's your word. Okay, by cytokines. So macrophage will produce so-called inflammatory cytokines, IL-1, IL-6, TNF-alpha. Everything is on the slide, so you don't have to write. Okay. These three you must know. Okay.
Which ones?
IL-1, IL-6, TNF-alpha. Interleukin 1, interleukin 6. Yeah. These are the inflammatory cytokines. What will be the effect of these cytokines? How can ask help? What will happen?
You get neutrophils from the blood.
So neutrophil granulocytes are localized only in the blood. Macrophage is everywhere in the tissue. Neutrophil is only in the blood. What's the name of the cell if a macrophage is in the blood? Monocytes. Monocytes in the blood, macrophage is in the tissue. So neutrophils are in the blood. How can ask the macrophage, the neutrophils from the tissue? Neutrophils are in the blood. How can they communicate? What will happen? Transmigration. Okay, so what will be the effect of the cytokines? Which cells will be regulated by the inflammatory cytokines? To induce open the vessels. Okay, so mostly the endothel will be affected. There will be three different functions. The first is vasodilation, okay, to more blood get to that where we have the pathogen. The second, increase the permeability. How can it increase? Contract the endothelium, yeah? And if we contract it, yes, okay, perfect. And the third one, the endothelium is swimming in the blood very quickly. Okay, so that's good. So that's why adhesion molecule will appear on the endothel, okay, in the lumen, in the vessel. Okay, so that's so the inflammatory cytokine has autocrine effect, activate the macrophages, and has paracrine effect, activate or modify the endothel. Okay. And third has endocrine effect. What's the endocrine effect? Brain. Okay. What will do in the brain?
Secret hormone.
Fever, induce fever in the brain. Induce prostaglandin synthesis in the brain, and that's why fever will be created. Okay. Yeah, okay. Fever, that's enough. I think the first 3 weeks, fever is enough. Okay, in the brain. Whereas, so endocrine effect in the fever. Okay. Due to prostaglandins. Forget prostaglandins. It's too complicated. Okay. Whereas, tell me other tissues where the liver. What will happen in the liver? It will acute phase proteins, perfect. A lot of acute phase, early and acute phase proteins. Probably you said I couldn't understand anything. The best known is the C-reactive protein. Okay, you said it, okay. Serum amyloid protein, C-reactive protein, and so on. The amount of the acute phase protein increased 1,000 times than the normal amount, okay, in the liver. What will be the function of the acute phase protein? The immune function.
Vasodilation.
Yeah, it does as well.
It does,
It
but
does
it's
later
okay.
on.
Later on, okay. The first, it will behave as an opsonin, we will speak about, and it will activate the complement system. We will speak about it. Okay. So we have the brain, we have the liver, and in the third, which is important at this moment, that in the bone marrow will induce the production of more neutrophils. Okay. So we see the autocrine effect, paracrine effect, endocrine effect. Okay. The first step of the inflammation, don't mix it, is that the macrophage recognize the pathogen. Okay. All the time the macrophage is the first one. Neutrophils is just the second. Neutrophil is somewhere in the blood, cannot detect the pathogen. First the macrophage. Only the neutrophil will exit from the blood.
No.
When the blood is permeable, anyone can go up. The complement system, natural killer cells, monocytes, everything. What will be the last step of the inflammation? We will go back in 5 minutes. Ask me in 5 minutes, okay? This question. Okay, so macrophage recognized here. One more. Macrophage will produce IL-12. That's the fourth cytokine. IL-12 will activate the natural killer cells. Okay? A natural killer cell will produce interferon gamma, the fifth cytokine, what you have to know. And interferon gamma activate the macrophages. So it's a positive feedback. Macrophage activate the natural killer activate the macrophages. Why is it good to activate the macrophages? Macrophages are professional phagocyte all the time engulf everything. But do not digest it, do not kill it. Macrophage fond of to keep the pathogens, fond of the bacteria inside, in the macrophages. But with interferon gamma, it will kill it. It will digest everything. Okay, due to the interferon. Okay, so the first cell was macrophages. I give it to you, but I cannot come to so many persons. It's incredible.
You're all here.
Or 10, 31, please, yeah?
31.
31. 31, okay, no more. So we finished the macrophages. We have another cell which is everywhere in all the tissues contain these cells, and when a pathogen arrives, this cell can recognize it. Dendritic cells. Okay, these cells are the dendritic cells. The same as macrophages, all the human tissues contain dendritic cells. Anywhere the pathogen arrives, dendritic cells will recognize for sure. Very good in recognition. How is it in killing? The dendritic cells.
It's not the first most important thing.
Yes, it's not the role of dendritic cells. Sometimes just by chance kill it as a side effect, but not that's the role. What's the role of the dendritic cells? Antigen presentation. So the dendritic cell grab the antigen and transport it to the lymph nodes. Okay, for the T cells. T cell cannot be activated without dendritic cells. So two cells initiate normally the immune response. Macrophages, dendritic cells. Macrophages kill the pathogen, dendritic cells just activate the T cells. Okay, that's the normal way of an immune response. So dendritic cells cannot kill.
Cannot?
Cannot. Can, but not that's the role. Okay. So
it has in
out of the three functions, dendritic cell good in recognition, good in communication, very bad in elimination. Who is the complementer? We have one cell who just want to kill. We finish. No, not only. You told me already. Neutrophil granulocytes. Okay, neutrophils are the stupidest guy in the immune system. Don't want to do anything, just to kill, just to fight. Okay. The wild animals, the tough guy of the mafia, the anything what you want. Okay. So where are the neutrophils in a healthy person? In the blood, only in the circulation, and in the circulation the neutrophils are inactivated. Okay? So that's why they don't do too big damage, okay? Because they are inactivated. Once the neutrophil get out from the circulation, it will destroy everything. Okay? Really everything. Will destroy the human tissues. Okay. Where will exit the neutrophil from the circulation? In a healthy person, the neutrophil all the time in the circulation, not to damage everything. Where can it exit from the circulation? In the gap where the macrophage asks him to come out. Okay? So the neutrophil will exit only at the site of inflammation, where the pathogen is. Okay? How can a neutrophil kill a pathogen? By granules. Okay? It's a professional phagocytic cell, so it can eat it, and it has granules. What does it mean? Granules, it's a preform something, and it's released. What are in the granules to kill the pathogen?
Hydrogen peroxide.
A lot of reactive oxygen species. What else? Nitric oxide. Okay, it's not so clear. What else? It's very simple. How can you kill a bacteria? With destructive enzyme, proteases, lipase, and so on. Okay, so these granules contain a lot of enzyme, and these granules contain antimicrobial peptides, small cationic peptides which destroy the bacterial cell. So imagine the situation: neutrophil exit from the circulation and release a lot of protease. The protease can distinguish human and bacteria. It's a stupid enzyme. We'll cut everything. There is a cysteine, I'm very happy I cut that. Okay, that's the philosophy of the protease. So that's why the neutrophil will destroy the human tissue, for sure. Okay? Anywhere in you or in your patient is an inflammation, the human tissue will be destroyed because the neutrophils are just stupid. Okay. What is pus? Dead neutrophils and dead pathogens. Okay. So we go through cells, dendritic cells, macrophages, neutrophils just to kill, can exit only at the site of inflammation. In a healthy person, only in the circulation.
You said 5 minutes.
That's exactly the 5 minutes, yeah? Okay, I'm exactly there. So, what is the last step of inflammation? Neutrophils go there, destroy everything. What shall we do?
Stop coming.
Clearance, it's important to eat everything, all the debris. And what else?
Stop the inflammation.
Stop the inflammation, very good. And tissue regeneration. Okay? So that's why the monocytes will get out from the circulation, became macrophages at the site of inflammation, and induce tissue regeneration. All the time, the last step is tissue regeneration. Good. Any other cell? Yeah. So the immune system has a special arm against parasites. Okay? Parasites are the biggest enemy of the immune system. Parasites are very complicated animals. Yeah? Too big, too clever, too many DNA, too many information. Can a macrophage phagocyte a 30-meter long parasite? For sure not. That's why the immune system has 3 cells specialized just to parasites. Can you tell me these 3 cells? Eosinophil and basophil to kill the parasites. Okay. So neutrophil, the granules of neutrophil will kill the fungi, bacteria, and so on. The granules of the eosinophil and basophil will kill the parasites. Special destructive enzyme to kill the parasites. And who can sense, who can detect? Mast cells. Okay, so these 3 cells, please put in one group. Mast cells, eosinophil, basophil, just against parasites. Mast cells to initiate the response, eosinophil, basophil to kill. Okay? Good. There is a very similar reaction than the parasitic response. What will it be? Very similar physiologic response. Then I ask it again. So the parasites are, the immune system are really afraid. Okay, the first reaction, not to kill the parasites, but remove from the human body. That's why when the parasite is intestinal tract, it will induce diarrhea, it will induce vomiting. When it's in the lung, coughing, sneezing. When it's in the nose, exactly. When it's in the nose, then running nose. Okay. What's the symptoms? Is that these are the symptoms of allergy. Okay. So when we are allergic, the immune system believes that the parasites arrive. It's not true because allergen is not a pathogen. It's not a living anything, but it's entered to the human body. The immune system misunderstanding, and it's an immediate hypersensitivity mediated by mast cells and basophils. Okay, so connect absolutely directly parasites and allergy. From the view of immune system, it's absolutely the same. Okay, and allergic reaction and antiparasitic reaction are mediated by the IgE immunoglobulin. We will speak about it in 2 weeks. Okay, so this information, IgE, allergy, parasitic response, keep it in your mind and in one group. Okay, very good question in multiple choice. Yeah. Who is important against parasites? 3 good answers, 1 bad answer. Okay. Good. So we finished the parasitic, the antiparasitic cells. We have 1 more cell, the natural killer cells in the innate immune system. So till this moment we spoke about the immune response against extracellular pathogen, against fungi, bacteria, or against parasites. How can the immune system kill an intracellular pathogen? To kill the extracellular is very easy. Attack the pathogen. Yeah? Phagocytic, toxic bacteria, or anything else. How can we kill an intracellular? There is a human cell full with viruses. The strategy is completely different, so that's why I told you to share extracellular, intracellular. In case of intracellular pathogen, the immune system wants to kill the human cell. Cannot get into the cell and show the viruses one by one, but kill the human cell. Okay? So the macrophages, neutrophils target the parasites, natural killer cell and cytotoxic T cell attack the human cell.
Activate apoptosis.
Induce apoptosis, okay, for example, that's one element. Okay, so two completely different killing philosophy, kill the pathogen, kill the human cell. Which part of the immune system will important against tumors?
Adaptive.
More? Soon. Cytotoxic T cell and natural killer cell. Tumor cells are human cells. Who can kill the tumor cells? These two. Tell me.
My name was on the list last week, now it's not.
Write it somewhere.
So on the back?
On the back, anywhere you can write it.
Killers.
I don't know what lactophages is. I will check. In the saliva. But it's not a cell. It's not a cell. I will check it. So till this moment, you must know about natural killer cell, the one to kill the human cell. Okay? And from now, so we finish the cells of the immune system and we finish the inflammation. 2 points out of the 6. We have here, everything is written on the slideshow, you must learn it. Okay, so before we start the recognition, 2 minutes about football, just to review. Okay. So that's my topic to show you how the immune system can recognize the pathogen. There was a football match, Barcelona against anything, Valencia, yeah? So any Spanish team, not Real Madrid. And this guy sits in the middle of the Barcelona supporter here, with the Real Madrid t-shirt. Okay, sit in the middle. The supporters will be angry, hit him, or I don't know what happened, so he must go away. How did the supporters know that he is my enemy? He's a pathogen.
The flag that is displayed. There's a flag.
Because it was a pattern, a t-shirt, it was flagged, which is a human never wear this. Okay, it must be pathogen. Okay, so in this case, the immune system focus to the pathogen. Okay, a pattern which is characteristic of a pathogen. Can you tell me such pattern which is only in bacteria, not in human? Tell me direct molecules. What has the bacteria which
Cell wall.
cell wall? Okay, typical pattern, pathogen-associated molecular pattern, a typical Real Madrid t-shirt. Okay, human cells will never express it. Yeah? Bacteria frequently express it. Bacterial cell wall, flagellin, viruses. Double-stranded RNA. Viruses all the time express double-stranded RNA. Human cells don't do it. Okay. So that's the strategy, recognize the enemy and kill it. Okay? How do we know who is a Barcelona supporter? There is no Real Madrid t-shirt, as far as I know.
What do you say?
How do we know that who is the enemy? Hmm?
Whoever's not wearing
Who is not wearing the human signal?
Yeah.
Okay? So that's another strategy. Recognize the human, not the pathogen, recognize the human and kill everyone else. Poor girl will die. It's okay. I'm really sorry her, but that's an existing strategy in the immune system. Okay? Recognize a molecule which is expressed in all the human cells. Do you know such a molecule? MHC1 molecule is expressed in all the nucleated human cells. So the natural killer cell will go all the cells for everything. If you express an MHC1, you are Barcelona supporter, you can survive. If you don't have MHC1, I kill you. Okay? So that's a different strategy. Focus to the enemy, kill it. Focus to the human, kill everything else. Okay?
What's KII?
I will tell you. And that's the third possibility. How can they play to each other? There is no Real Madrid, no Barcelona t-shirt. How can no pattern? Okay? That will be the strategy of the adaptive immune system. Recognize the players, recognize everything face to face, name by name. That's what we call specific recognition. I know that Frank is me, Joe is not me. Okay? So that the adaptive will know the names directly, specifically the pathogens. Okay, so the strategy of the immune system, recognize the pathogens by pathogen-associated molecular pattern. Okay? We call it PAMPs. The PAMPs are recognized by pattern recognition receptors. You must know it. PAMPs by the strategy to recognize such molecules which is frequent in the pathogen, but for sure not in human. Okay, Barcelona supporter never will reality tissue. One more very important sentence, the recognition is inevitable. So currently, all the microbes are recognized by this strategy. Because viruses express double-stranded RNA, bacteria express flagellin, fungi express zymosan. Okay, you don't have to know everything. Okay, just one sentence, recognition is inevitable. What will happen if something came from the moon? A new species, yeah, new enemy, an alien came from the moon.
Give him a home.
The immune system can recognize by pattern recognition receptors. Hopefully, probably not, because I don't think that alien has flagellin. Okay, the chance is very low. The alien won't be reality tissue. Okay, so this strategy is very good. At this moment, everything is recognized in the world, but very hard to recognize new things. How kill the immune system the aliens? Aliens do not express MHC1. Natural killers are killing. That's why it's good to recognize the human, kill everything else. Okay. You must know it's rather a lexical slide. We have 6 different groups of pattern recognition receptors. Toll-like receptor, you must know it. Read and node-like receptors are intracellular receptors. So pattern recognition receptors can be expressed on the cell surface or can be intracellular. Intracellular pathogens will be recognized. Scavenger receptors, just memorize the name. Lectin receptors, what is lectin? It's a molecule which recognize sugar molecules. Okay, so it's proteins which recognize sugar. Prokaryotes fond of to utilize mannose. Eukaryotes never use, or use it, but very few of them and in a hidden position. Okay, because so it can receptor recognize mannose, it means that it recognizes prokaryotes. Sialic acid is the opposite. Prokaryotes do not use it, eukaryotic cell use it. Okay, so it's a Barcelona tissue. Yeah. If the immune system sees the sialic acid, then it's not a prokaryote, I let them in. And for methionine, it's not known. All the bacterial proteins start with this special amino acid. Therefore, that's the initiator of the translation for bacteria, but not for human. Okay? So all the bacteria protein express it, human not. So these 6, I will ask the name of this 6th group, and I will ask that whether the pattern recognition receptor can be on the cell surface or can be intracellular. Both. Extracellular pathogen will be recognized, intracellular pathogen will be recognized by pattern recognition receptors. Okay, let's see the dumps. Is it enough for the immune system to distinguish human from human?
No.
What about tumors? Tumors are human but don't have bacterial cell wall, yeah, for sure. But my enemy. So it's not enough to distinguish. What about the commensal bacterial flora, which is these normal bacteria, symbiotic bacteria live in the human intestine. Yeah? So it's not enemy, but express bacterial cells. Okay? So that's why the immune system will recognize danger or damage-associated molecular pattern to distinguish dangerous, non-dangerous, normal, abnormal. Okay? I will show you some examples. The best example is the necrotic cell death. Okay, tissue damage. What will be the last step of apoptosis? The regulated cell death is apoptosis. What's the last step? Phagocytosis, engulfment. Okay, the neighboring cells and professional phagocytic cells will remove the debris. The intracellular components will be covered by an envelope. Okay, nothing can go out from the cell. no any intracellular protein will appear in the extracellular area. What will happen during necrosis, which is a non-regulated cell death? Everything just go away. Okay, so that's why extracellular ATP, extracellular heat shock protein, extracellular actin molecules means the immune system when something abnormal happens, non-wanted cell death, tissue damage happen. Okay, so these molecules are the damage associated molecular pattern. So both pathogen and both pumps and dumps induce the same reaction. Macrophage cannot distinguish that it's pump or dump, will induce the inflammation. Okay? Tell me any example about the sterile inflammation in your life, where there is no pathogen but there is inflammation. Sterile inflammation. Inflammation without pathogens.
Autoimmune.
Autoimmune, no. Can be, but no. What's the symptoms of the inflammation?
From the inside of the body. Cardinal sign. From the inside of the body.
Redness, swelling. When you have swelling in your life. Trauma, any case of trauma. Tell me a trauma. During sport, strain my ankle. That's an inflammation. Where are there inflammation? Why are there inflammation?
Some cells are very more.
Because it's a tissue damage. Macrophage recognize the necrotic tissue, induce the inflammation. If you punch me, what will happen? Tissue damage. Because you want to go out. I know. So what will happen after the danger signal? Which cells will go there? The neutrophils. Yeah? Neutrophils destroy the human tissue. So sterile inflammation cannot be healthy. Okay? The neutrophils will destroy your tissue. So if you or your patient has inflammation, reduce it. Yeah? Put isonate or do steroids or anything. Inflammation cannot be healthy. Okay? Sterile inflammation. Let's speak a bit about smoking. What will happen if you just aspirate too much heat without nicotine? Just the burning paper. If you
That's not good.
what will happen in your lung? Coughing. Okay, so then